How does pharmacodynamics affect the immune system? Imagine your body as a busy city, and drugs as messengers trying to send signals to keep everything running smoothly. How these messengers work depends on their interactions with the city's infrastructure. That's where pharmacodynamics comes in. It's the study of how drugs produce their effects in the body, including how they influence the immune system. Some drugs act like friendly helpers, boosting immune responses to fight infections or cancer. Others are like peacekeepers, calming an overactive immune system in autoimmune diseases. And some drugs might unintentionally cause chaos by affecting immune cells in unexpected ways. The key is understanding how drugs interact with immune cells, receptors, and signaling molecules. These interactions can either strengthen, weaken, or redirect immune activity. For example, certain medications are designed to target specific immune pathways. They might block receptors on T cells to reduce inflammation in autoimmune conditions. On the flip side, some drugs not meant for immunity can still change immune cell behavior as a side effect. This is important because it shows how drug effects are not always straightforward. Drugs are classified based on their impact on immunity. Immunostimulants increase immune activity, helping the body fight off infections or cancer. Immunosuppressants do the opposite, lowering immune responses to prevent organ rejection or reduce autoimmune damage. The way a drug works depends on its mechanism of action. For instance, a drug that blocks the CCR4 receptor on regulatory T cells can reduce immune suppression, possibly making vaccines more effective. Conversely, drugs that activate adrenergic receptors might boost regulatory T cells, promoting immune tolerance and reducing autoimmune symptoms. Pharmacodynamics also influences how long and how strongly a drug affects the immune system. High doses might cause a quick, intense change, while lower doses could lead to gradual, long-lasting effects. The method of administration, whether by injection, pill, or topical application, also impacts how the immune system responds. Sometimes drugs cause unintended immune effects. For example, some medications activate natural killer cells, releasing inflammatory signals that can damage tissues like the liver if the response gets too strong. On the other hand, drugs that suppress immunity too much can leave the body vulnerable to infections and slow healing. In treatments for infections, combining antibiotics with immune support can speed up recovery. But finding the right dose is vital to avoid side effects or resistance. In chronic illnesses, drugs targeting specific immune pathways can reduce symptoms and prevent tissue damage. However, they need careful monitoring to prevent tipping the balance toward too little or too much immune activity. Overall, pharmacodynamics shapes how drugs influence the immune system by determining which cells and pathways are affected, how intensely, and for how long. This interaction is at the heart of both the benefits and risks of drug therapy. It highlights the importance of personalized treatment plans that respect the immune system's delicate balance.